Thank you, Madam Chair. We're now moving to fellow item number 1, SB 58 Padilla. Senator, you are recognized when you're ready.
Thank you very much, Madam Chair and members of the committee. I'm pleased to present SB 58, and first would like to state that we're happy to accept the committee amendments and appreciate the good work the committee staff has done. Hydrogen sulfide is a colorless, highly toxic gas with strong odor, detectable in very low concentrations, and is formed during bacterial decomposition of human and animal waste, and much more that we're learning through more contemporary science. The standards for hydrogen sulfide were adopted in 1969 for the purpose of odor control and nuisance. That was last reviewed in 1981, nearly 50 years ago, and has not been thoroughly updated or reviewed with contemporary data since. In my district, 2 hotspots of hydrogen sulfide have been identified in the Tijuana River Valley and at the Salton Sea. Community researchers have monitored these areas and have found that monitoring procedures are inefficient, with concentrations of the gas found at much higher levels, some highly exceeding recommended safe levels. Our current framework for hydrogen sulfide does not take into account some of the unique nature and features that are occurring in these locations. This has created confusion and has also limited our ability to create an appropriate response framework. Exposure to this has been associated with health symptoms, numerous, including respiratory, gastrointestinal issues, headaches, fatigue, nausea, skin irritation, and respiratory irritation. These exposures disproportionately affect vulnerable and environmentally overburdened communities, including low-income households, immigrant communities, Latino and tribal populations in areas already experiencing elevated rates of respiratory and other illnesses. SB 58 seeks to protect public health of Californians by strengthening our ability to detect and respond to hydrogen sulfide releases. In particular, in identifying and evaluating the triggers that we're becoming aware of. That also would primarily surround looking at public health impacts and community health impacts and making that the framework through which we look at standards, which we have not done in the past. Here with me today to testify is Dr. Arzeno-Soltero, Assistant Professor at the Department of Civil and Environmental Engineering at UCLA, and who's also with the UCLA Latino Policy and Politics Institute. Thank you, Doctor, for being here.
Thank you. You're recognized for, there's only one witness, 4 minutes.
Good afternoon, Chair Blackspear and committee members. My name is Dr. Isabella Arzeno-Soltero. I'm a UCLA faculty member, and I've been studying air and water quality in the Salton Sea for over 5 years now. I am here to share recent data on hydrogen sulfide air quality exceedances, which show a serious gap between how air quality is monitored and regulated and what Salton Sea residents experience every day. Our findings highlight 2 key problems. The first being that state regulatory monitors are not capturing the full extent of hydrogen sulfide emissions. While regulatory monitors have recorded exceedances in the region for more than a decade, data from community air sensors show that hydrogen sulfide concentrations around the Salton Sea violate the CARB state standard far more often than state monitors report. This is because the few state monitors that exist are spread far apart and miss many hydrogen sulfide events. The second point is that updated state standards could better protect public health, especially in under-resourced communities. The Salton Sea is surrounded by predominantly low-income Latino, Indigenous, and immigrant communities who experience disproportionate respiratory health burdens. Community members consistently reported headaches, nausea, nosebleeds, irritation, and feelings of suffocation associated with odor, particularly on hot and humid days. Residents also described regularly having to alter their daily lives in response to these conditions, avoiding time outdoors, keeping children from going to parks, restricting normal routines, and in some cases being awakened in the middle of the night by the odor. Taken together, these findings demonstrate a fundamental disconnect between current air quality monitoring efforts, regulatory standards, enforcement of the standard, and the persistent harmful conditions experienced daily by Salton Sea residents. And this underscores the need to lower the standard and strengthen enforcement. Thank you for your time and consideration.
Thank you. Do we